Hey everyone, it's Dr. Hillary Heschauer from Rangeline Chiropractic. I'm with one of my favorites, Dr. Latisha. She's a physical therapist. Say hey.
Hey.
She's going to tell us about herself and her practice in Broad Ripple, and I highly recommend her. If you're a patient of mine, I'm sure I've talked to you about her and her running and gait analysis and everything, but I love that she had time for us today to talk a little about winter wellness and some exercise. So take it away.
Yeah. Hi, everybody. Just a little bit about myself. I have practice in South Broad Ripple, just off of 54th and Keystone, and I primarily help active adults and women ages 35 and above and runners to help them with optimizing the way they move, feel, and perform, looking at everything from nutrition, sleep, to their fitness level, and then incorporating all those things into some kind of non-traditional physical therapy practice where we combine total body wellness as well as rehab and strength and conditioning.
Love it. And you got to think of this whole topic. It was your brainchild. So tell us about winter wellness. I know right before we jumped on, you told me a little bit what you're going to talk about, but I'm sitting in anticipation to hear what we're going to learn about today.
Yeah. Well, there's really three particular areas that a lot of people struggle with, especially in the wintertime, and it could be at being overall throughout the year. So I like to think about fitness, nutrition, and stress. So we know the winter blues are something that very important that is really real, and especially like on the days that we're having now with being snowed in, we haven't had a significant snow probably in a long time here,
Yes.
where we've had all these cancellations. So just kind of fitness, looking at those first three things. Let's look at fitness first. Excuse me. I've been talking a lot. I've been doing podcast episodes, so I have to clear my
We
throat.
won't say the C word.
Yeah.
That ends with an id.
Yes.
Not it,
So,
you guys. It's not it. She just talks too much.
yeah, pretty much. So, fitness wise, I like to have people, any type of movement that you can do is obviously is great, but really incorporating things that help with boosting your metabolism and giving your biggest bang for your buck. So I always try to say, especially with ladies, we tend to neglect this strength training component of it. We're real comfortable with cardio, hopping on the treadmill, running outside, or popping in a video and doing like a cardio hit program, and all those things are great. But another thing to really add into the plan is going to be strength training. It's going to give your body the ability to burn for longer periods of time, and being able to optimize some of those areas that you're probably thinking you need to work on, like your abdominal area.
I
If
was
you're
just
over
saying,
30, yeah,
like the core,
yes,
perhaps?
yes, exactly. If you're a woman over 35, you know what you used to do even a few years ago. Your bounce back isn't quite there.
True story.
You're like, all I had to do was change this or change that, and the weight would, come off, or your energy levels are off because of hormonal shifts that are, are occurring. Your sleep is kind of wonky. You're like, what is going on here? Yes, we're going through some changes, but we don't have to resolve to the fact that we're going downhill of that. There's things you can do to moderate, to reverse some of the changes and kind of optimize your health. So strength
All I
training.
heard was reverse aging. Is that what I heard? No, I'm just
Yes,
kidding.
reverse. Yes, that's exactly what it is.
Everyone
Yes.
should come to you because she can reverse aging people.
Yes. Yeah, exactly. Yeah. Don't say
I
that.
like to hear what I want to hear, just so you know.
Well, yeah,
We keep
we'll
going.
take it.
Keep going.
We'll take reverse aging.
Okay.
So, if you're beginning a new program and something you're not familiar with, it's always good to make sure that you start out slow and at a pace that is comfortable for you. If you need to get checked out by a healthcare professional, or if you're worried about, hey, I have a nagging back, knee, or whatever issue back from high school or something that's popped up now, don't get overly excited and jump back into like a high intensity exercise routine, and then you'll be like, man, I can't even get started with that again, because those things will start to pop up. So I always advise people, start slow with that. And then next is make sure that you know the difference between an ache from starting an exercise routine and an actual real pain.
Good point.
So an ache, a muscle ache, yeah, I had a hard workout. A pain, okay, this has been going on since last week, last month, last year. That's something different. That's not just, oh, I'm getting old, or it's because I'm starting this routine, or I always have to do the modifications when I go to boot camp, and because that's just the way my knees are. Well, there's some things that you can do that you can step yourself out of. I always have them do the modification, or thinking that you have so many days to recover. You know, you feel like you go to one workout and then you're like, dang, I need 3 days to recover from that. Because guess what? There's some underlying things that could be going on with hip strength, flexibility, mobility, and a lot of those classes are called, you know, like core or strength, but it's a different type of strength and stability that you need that you may be lacking. So get that stuff checked out, even if it's just going to get another set of eyes on it, or making sure before it turns into something more significant, you just nip it in the bud.
Yeah, for sure.
So, yeah, you're like, yeah, for sure. You're like, this is not a return to exercise pain if you're limping up the stairs, or every time you start this one move, you have pain with it. So don't, listen to the voices in your head that say maybe that's something wrong, or sometimes you don't have that voice. You just say push, push, push. Because I know when I was younger, I didn't have the voice that said stop. It was, oh no, it's no big deal. I'll just keep going, and you pretty much had to have something hanging off your body or cut off for you to say, oh, well, maybe there is a problem.
I've seen both cases in people. People on that spectrum. I've also seen, oh, I shouldn't do that because I hurt. I'm like, yeah, that's because your muscle's working.
Yes.
So
yes.
There's a line, isn't there?
Yeah, oh, for sure. Yeah, because difference between, oh, I haven't done this in a while, my muscles are now waking up now for a new routine. Yeah, you're gonna have, you'll be probably feeling some aches and muscle soreness compared to, yes, you've done 150 box jumps and you haven't ever done one, but you did 150 today. Yes. And now you're having knee pain or, back issues or whatever it may be.
Yeah.
So I'm sure you've seen probably quite a few people kind of coming in and saying, hey, I did such and such, or I just started this and now something's off.
Yeah. And even like when they go through a treatment plan, I'm like, all right, you can start working out now, but we're going to go, less weights, more rep. Like you're not jumping into where you were. And they're like, okay. I'm like, no, I'm serious. Don't weak, like for real.
Yeah. Less reps.
Yeah, I know.
Yeah, I've definitely seen that too. And I think that was one of the reasons that I got out of kind of traditional physical therapy practices, because we were taking, first of all, we had 3 and 4 people there at the same time. So we couldn't really give the care, and attention that people needed. And then second, we would only kind of take them up to a certain point. Okay, now your pain's decreased. You may be able to go up the stairs now. But guess what? You were a runner, or you did CrossFit, or you wanted to start something new. You weren't ready when they said discharge from therapy. You weren't ready to return to that task. So people didn't have a plan for, well, now I've graduated from PT. I'll just go and get started. And then it sets yourself back up again for reoccurring things or new injury to occur. So that was one of the things that I got frustrated with in that setting.
I get it. What kind of exercise or movement routines are you recommending right now during these winter months?
Yeah, I think what really is going to be impactful is that obviously if you have something that is accessible and something that you're going to enjoy doing. Because I can say all the best exercises and the best movements and the fad of this and that that's out there, but if it's not speaking to you or you don't have access to it, it won't do you any good.
Yeah.
So, the most convenient things you can work on is working on larger muscle groups. So instead of like sitting here and doing a bunch of, bicep curls, oh yeah, biceps. Well, that's working one muscle on a single joint. Work larger muscle groups so you get your biggest bang for your buck. So that's going to be your glutes, quads, working on, core muscular. So you're going to have combination movements so that you can get a shorter workout in and impact as many muscles as possible. So
Oh,
that could
love
even
it.
be, you're working at home, you're at your desk, doing stand up and sit downs, crossing your arms and stand up and sit down, setting a timer and seeing how many you can get. That
Oh, I
works.
love that.
That works
Yeah.
large muscle groups. You're in between Zoom meetings for clients. I have 5 minutes. Hey, I set a 2-minute timer and I do sit to stands for 2 minutes. Use that same chair. Now you can use that chair and do push-ups on that chair.
That's
So
great.
you're getting large muscle groups involved, and your body is gonna want to be a more efficient burner of fuel and in boosting your metabolism, which we know is slowed, slowed it down. And sometimes when you hit too hard in the one area of hitting a bunch of cardio hit spice things, sometimes your metabolism can be affected, and it may be because I'm a runner, so I do love to run. But the missing component in a lot of runners that I see is that they think that by running, that's making their legs stronger. And they think that running also, you bulk up if you do strength training, and you don't need strength training for runners. I had a lady in a group were saying, oh no, I don't think you should do squats as a runner. I don't see the benefit. I'm like, do you know the muscles of running? Those are the same muscles of squats are used.
Apparently she doesn't.
use them. Like, it's just those different myths that pop up. And just like with women in weights, oh, I'm gonna look like Arnold Schwarzenegger, if I lift weights, or I'll bulk up, or I won't look this and that, or just being able to have a resource to say, where do I start? So sit to stands, large muscle group, doing push-ups using the chair. You can stand up and do leg kicks out to the side, forward, back. That's just simple things that you can do. Is like your little chair exercise circuit. If you have access to weight, then yes, go ahead and add some load to that. You can see probably in my background that I have a squat rack in my office.
You got that for a gift, didn't you?
Yeah, I'm at a home office. Like, you're a little bit of crazy if your husband gets you a squat rack for your birthday.
I remember you posting that and how excited you are. I thought, well, Lisa's not like a vacuum cleaner.
Yes, yeah, exactly.
Like how my husband thinks I should get a snowblower for my birthday. And I was like, don't ever do that.
Oh yeah, that's exactly what I wanted, a snowblower.
Yeah. Heather popped on. She said that she's loving this info. If anyone has any questions, put it in there. I can pop it up on the screen, and we can always disrupt my ranting about snowblowers to ask a real question, just so you guys know. Anyone listening?
Yes, definitely. Yeah. Anything that's household that requires you to want to cook or clean more, that's not a gift.
No. Well, moving on, tell us a little bit about like what you're telling your patients about sleep during these winter months.
Gotcha. I think sleep is one of those things that, people have probably just gotten so used to the fact that they have lack of sleep that they don't even realize they're sleep deprived. So you just kind of get on autopilot and you're like, okay, I'm used to 4.5 to 5 hours of sleep, go, and not realizing that increased stress that's going on in your body over time, as well as some of your cortisol or your stress hormone levels begin to shoot up. And we don't always get those cues and alert that something is going on until boom, something major happens. So all that stuff that's going on in the background, our body is giving us little cues, and we're just saying, oh, that's because I had a hard workout, or, I had a stressful day at work. I have tension in my shoulders, or, I have a headache because, I didn't drink coffee today or something. Well, some of those cues are stress levels are beginning to pop up, and sleep is one of the number one things you can do to help with that. So I've really gotten the habit now, even because my sleep is being affected. I'm in the last years of my 30, so I'll be 40 this year. So my sleep has been starting to be, disrupted. And it's because of some of those changes that are occurring. And we're always packing in more things into our day. We get so overly busy. Sometimes at nighttime, we don't have that shutdown that says, now it's time to prepare our body for rest. And so sleep, I tell people, obviously 7 to 8 hours is ideal, but set up a sleep routine. So my sleep routine has been a meditation sequence, as well as adding in sleep and stress relief yoga. So I've been trying to do that more often to clear my mind and shut my body down to say it's ready for rest.
That's nice. Yeah. And getting away from all the tablets and TVs and stuff.
For sure.
Right. I know.
It's hard to do.
Sure is. Sure is. Um, let's see. I think we touched a little bit on stress, but was there anything else you wanted to mention about stress in these winter months and exercise?
Yes, those when you add in that point of some movement and exercise, it's going to automatically decrease our our stress levels.
Mm-hmm.
So being able to look at our full self and not to say, oh yeah, I'm exercising, but if your nutrition isn't there and your sleep habits and stress, then you're fighting against yourself all the time.
Mm-hmm.
So those three factors, fitness, nutrition, and stress, they all play together in the bigger role in how you're going to be able to optimize your health and wellness.
Yeah. Okay. Let's see. We chatted a little bit right before we talked about the winter blues that are upon us.
Mm-hmm.
It's interesting because like just this week I've had a lot of patients mention it to me. They're not mentioning that they feel they have it, but they just were saying something about it. And I thought, ooh, it's just about time that's going to set in, isn't it? If it hasn't already, with the lack of the sunlight and
Mm-hmm.
being stuck inside for like, what, we're going on like 9 months now. I mean, come on.
Yeah. I mean, it's a real thing for sure.
Mm-hmm. Yeah.
Yeah, I think the winter blues can occur with a lot of different people, and you may not, and your body, the way you respond to it could be very differently. So if you just kind of focus on the things you can do and you can control, then it helps with just kind of like resetting that mindset.
Mm-hmm. So definitely the exercise, stretching, moving, helping with winter blues. Do you recommend any foods or supplements for your patients?
The main thing I recommend definitely for ladies is always going to be vitamin D. So people think just because I can go out into the sun for a little bit, then I get all the vitamin D I need. I have been drastically low in vitamin D, and I was running outside doing a lot of different activities. And that lack of vitamin D also plays a role in, your brain function. So it could be contributing to why you could be having more feelings of feeling down and just don't have enough get up and go. So vitamin D, iron, foods to kind of help with that is I tell ladies have protein with every meal.
Mm-hmm.
So bump up your protein for sure. It helps with recovery and also helps you with protein and fiber with helping you feel fuller longer, so that you're least likely to kind of reach for some of the carby and more sweet snack, the comfort foods of the winter time.
Yeah. Yeah. I think we all know a little too much about comfort food lately.
Yeah, for sure. And it's okay. You have to get a little comfort in there,
Mm-hmm.
but some things to be able to boost your energy and your wellness are definitely going to be with vitamin D, iron, and then getting that protein in.
I know. I would go so far as to think probably all the people we know are probably all vitamin D deficient.
Mm-hmm.
I mean, I'm sure we could find one person, but it would be hard to find someone that was in the correct range for vitamin D these days.
For sure.
I'm
Yes.
always shocked at my levels too. But then again, I on and off taking my vitamin D. I take the liquid, so it's really easy. It's just, I have to sit it by my desk down here by my monitor, and I go, oh yeah, I better take that today.
Yeah, I do the pocket technique. I put them in my pocket, and then
Mm-hmm.
sometimes at night they're still in my pocket.
Mm-hmm.
So I have to definitely be better at that too.
Mm-hmm. What's your favorite protein? We were talking about protein. And I just thought, oh, let's learn a little bit about what you like to eat.
I have been doing a lot of I do eat meat. I try to increase a lot more plants. So at one point I was probably like 80-20 plants, but now I've incorporated some more meat. So I'm a big chicken, fish, and beans.
Okay.
So, as far as my protein, I always add in quinoa and chia seeds. That's good protein and fiber. So I try to add chia to whatever I can add it to. It's another way to have a lower calorie. So add it to Greek yogurt, add it to my oatmeal, all the things so I can bump up my protein and fiber levels.
Yeah, I never think about chia like to buy it on my own and put it in things, but I like it when I'm going places and you can add it to like a smoothie
Oh yeah,
or your bowl. I'm like, oh yeah, let's add that.
yeah. And
Mhm.
I do a protein supplements, but I always the plant based. So I use the plant based protein
Yeah,
powder when I do shakes.
me too. We've got a question. I'm gonna pop it up.
Okay.
Liquid versus the pills for vitamin D. I don't know really the best. I don't know which one's better. I would think the liquid could get into your bloodstream faster. What are your thoughts?
Yeah, that's what I was thinking too. I was like, I don't know if there's anything more better more than the other, but yeah, I would think that liquid, you don't have to break down a pill. You have to break down a pill, so the liquid probably be faster to go in the system. And people that have even just problems with swallowing pills,
That's true.
you
I
know,
was trying to find mine to show you guys, but
yeah, I use
this is the
the
problem. I've probably lost the
yeah. I was
bottle.
gonna
This is
say
why I'm
you
not
taking it
taking it.
today.
No, I haven't because it's not in the spot that it's supposed to be. Dang it. My liquid one's like a really high dose, and then I don't have to take a lot of pills. I have so many supplements, and I do love supplements. You get just tired of taking them, and sometimes I just like liquids, squeezing
Same.
it in, swallow, back to drinking what I want to. And I use the same liquid dropper for my kids too, because I can just do like two little drops with them instead of getting them to like swallow something and argue with me. I'm like, just
Yeah.
open your mouth. It's like baby bird. Just open it and let me just drip it in there.
Yeah, I do the same thing for my son. Yeah, because my son is about to be 12 and he can't swallow any pills. Yeah. So it's like he's taking all the coating off of it. And I'm like, yeah. So liquid is just so much easier.
Yeah. Other than that, I can't think of why a pill versus liquid would be, one versus the other. It's probably just preference.
Yeah.
Thanks for asking the question, though. Okay, and then the last thing I think we wanted to touch on is sitting too much. And I really liked when we started the conversation, you talking about like sit and stand, get up, doing squats. I love that. Like just setting like what, a timer
Yeah.
every hour, go off. I mean, how easy could that be on your phone or computer? And then you just get up and squat for 2 minutes. How great.
Yeah, for sure. Yeah. The whole sitting is like, that's the new setup for chronic disease is the problem is just having sedentary jobs, especially
Mhm.
it's been more impactful now over
Mhm.
this last few year when people that were used to going out and doing things and now are like, guess what, your home office, that's your desk, your broke down kitchen table chair that you have, that's your new desk chair. And like
Mhm.
people were not set up to have an ergonomic setup for their desk at home. You use
Yeah.
the chair that was there, desk, maybe your lap was your desk with your laptop on your knees or sitting on the couch hunched over things. It was a setup for a lot of aches and pains on top of increased stressors and anxiety during this time. So having the appropriate setup, I've gone in and looked at people's different desk setups before
Mhm.
and say, guess what? Your screen needs to be at your eye level. You don't need to be looking off to the left and to the right or down.
Mhm.
Sitting, you know, your knees are supposed to be lower than your hips when you're sitting, and your feet are supposed to be flat on the ground. So if you have a chair that needs to be adjusted, please do that. Or if you got to sit on a cushion or adjust things that way. But those little mini breaks are good just to kind of reset our posture and get our mind out of staring at a screen all day too.
Yeah, I totally agree. I love it. Well, we are ending our time. Is there any other words of wisdom that you want to impart on us today?
Yeah. Well, I just encourage everybody to get up and get moving and doing something. For the month of March, I actually am going to have a 21-day reset for women over 35. It's going to be an online program that we look at literally those three areas. We look at fitness, nutrition, and stress. So we'll be able to have strength training program that's going to be incorporated in there. We're going to have movement and meditation with yoga. I'm actually in the midst of getting my 200-hour yoga certification. So it'll be some good practice time
Nice.
for me. So it'll be starting March 1st and it's $1 a day. So 21 days, $21, trying to get as many women as possible involved in getting that reset that they need to kind of take back their health with the
Well,
challenge.
I'll sign up. That sounds wonderful. Where should people, I mean, I know how I would find you, but how do other people find you and to get
Gotcha.
signed up for this?
I'm gonna say I'm working on the link. I had to hop off, but I can put the link in the group if that's okay after
Sure.
this. But you can also find me on Instagram. I have two different accounts. I have at Dr Latisha PT. That's with my overall wellness that I focus on women, and then my physical therapy practice is at Run for Life Indy.
Great. Thank you so much for being on here. I look forward to the 21-day challenge. I can definitely do that. Is there a prize? Because I might try to win that.
When
But
well, we might have to make it kind of some competition. No.
I like some competition, friendly competition, that
Friendly
is. But,
competition.
thank you so much for being on here.
Oh, no problem. I enjoyed it. Thanks for having me.
Yes.